Hello everyone, I'm John McCullagh from PositiveLight.com, and I'm here today with Shannon Ryan, who is the Executive Director of the Black Coalition for AIDS Prevention, one of Toronto's AIDS service organisations. And Shannon, I wonder if we could start our discussion by you telling us a little bit about Black CAP and its history.
Sure, I'd love to. Black CAP is an AIDS service organization that works in Toronto's African, Caribbean, and Black communities. Black CAP has been around since about 1989. We were started by really a collective of people who felt like the existing AIDS service organizations that were serving the needs of people living with HIV/AIDS weren't really meeting the needs of people that looked like them. That's Black, African, and Caribbean people. And there was kind of a sense that we needed to kind of carve out our own niche, create our own space, and create programming that was kind of delivered from this approach of for us, by us, right? Recognizing that, the mainstream organizations are great, but we need something more. Right. We need services that are delivered from our own perspective in terms of how our communities look and how our communities talk and how our communities approach sex and sexuality and HIV prevention and all of these things. So a great group of people started Black CAP in 1989, and following that, we've grown. We started out with one staff in an organization called Harambee Centres Canada, which was a multi-service organization for Black African and Caribbean people in Toronto, and we grew. Actually, no, let me go back a little. Even before that, we actually had a desk at ACT before we moved to Harambee.
That's the AIDS Committee of Toronto.
Yeah, that's right. And ACT gave us our first desk space. I can't ever let that be forgotten.
Right.
They gave us our first desk, and we grew from there. They were kind of our starting point, which was really great, and a great support offered by them. We grew, from Harambee we went to Parliament Street. From Parliament Street we went to Spadina Street, and we ended up here at 20 Victoria Street in downtown Toronto. We've grown from an agency of having one staff way back in the early 90s to now having almost 20 staff who provide a broad range of services and supports to do two things. The first is to prevent new HIV infections in Toronto's Black, African, and Caribbean communities. And the second is to support Black African and Caribbean people who are either infected or affected by HIV and AIDS.
Right. So, Shannon, the African, Caribbean, and Black community is large and diversified. So can you tell us a little bit about some of the communities that you provide services to?
Sure. So recognizing that HIV in the Black community is actually predominantly a heterosexual disease. About 2/3 of all Black people living with HIV in the province right now are actually straight. Which is kind of goes a little bit against kind of the communities that most AIDS service organizations work with. They probably work with the majority of gay men. So we actually work with the majority of heterosexual people. Not to say that we're not very, very focused on gay men as well, and lesbians and bisexual and trans people as well, but we really recognize that there's a lot of HIV that's transmitted through heterosexual sex in our community. And that's really an important thing for us to keep in mind. Our community looks a little different, right? We're also a relatively young community as well, the Black community in Ontario. Unlike our African American counterparts who have been in America for hundreds and hundreds of years, the Black community in Ontario is it's very young, since the 50s, 60s, 70s, and we had relatively small numbers of Black people in Ontario, but we've seen big increases in the past 10, 15, 20 years. So the communities have actually grown quite a bit. What does that do? That makes our work actually much more complicated.
Right.
Because we're working with a number of people who are from a range of countries. A number of countries from the continent, a number of Caribbean countries, a number of Black Americans who come to Canada, and not to mention Black people born in Canada. So we're working with this incredibly broad diversity of people, which means that we've got to really develop a broad diversity of messages when it comes to prevention and a broad diversity of programming when it comes to support, which makes things really complex and challenging.
So the community, as you say, is growing exponentially, yet at the same time I know that the rate of HIV infection amongst African, Caribbean and Black communities is way out of proportion to its size. So what's the reason for that, do you think?
Well, I think there are a lot of reasons. Yeah, you're right. Right now, Black people represent about 20% of all people living with HIV in the province of Ontario. Across the province, the Black community actually represents about 4% of the population, I think it is. So there's something out of whack, right? There's a real high level of disproportionality here that plays out in new diagnoses and plays out in terms of risk. And I think there are a lot of factors that contribute to that. I think a lot of it comes down to misinformation about HIV. Who gets HIV, how you get HIV, how you can protect yourself and your partner from acquiring HIV. There's another factor I think that is perhaps even more relevant than limited levels of knowledge. I think it's very much also about HIV stigma and homophobia in Toronto's Black communities.
Right.
It's hard to talk about HIV. It's hard to talk about sex and sexuality in our community. Many of our communities are very traditional communities, right? Many first generation, second generation, Jamaicans and Ghanaians and Zimbabweans, et cetera, et cetera. And some of those attitudes and perceptions that people had at home actually get translated and held on to. And rightfully they should be held on to. But, some of those attitudes around HIV and homophobia actually contribute to people's risk for HIV, right? And I think it plays out in ways that are really strange. I think in our community, most people think that people with HIV in Canada are going to be gay men. It's not going to be Black people. It's going to be, either the gay guy down the street, it's going to be the woman who shoots drugs, but it's not going to be me as a heterosexual person who's at risk.
Except at the same time, I would think that a lot of the people that you would serve are immigrants to Canada from countries where HIV is endemic.
Exactly. And what I think happens is that people come and they let their guard down, right? HIV maybe isn't as in your face in Canada as it used to be, right? It seems that it's kind of in terms of the hierarchy of discussions that take place in the public sphere, HIV, especially in the Black community, I think is really way down the list, unfortunately. And you're right. In people's countries of origin, HIV is really present. It's very visible. You're going to have an uncle or a child or an aunt or an uncle who's died from HIV, right? You're going to have an uncle or an aunt or a child or a cousin who's on HIV treatment. But I think when people come to Canada as newcomers, it's not as visible and present. There's a healthcare system in place. People aren't talking about HIV as much as they could be. Black leaders aren't talking about HIV, right? So there's a real kind of easing of I don't need to worry about it as much. Not to mention that as Black Canadians, we're also worrying about a whole bunch of other things, right? Our community is under a lot of scrutiny. We experience a lot of racism and oppression in the broader community at both systemic and individual levels, right? And when we're dealing with things like poverty and limited access to health care and, dealing with a government that is not very friendly to us in terms of immigration, HIV sometimes falls way down the list. We're dealing with a lot as a community, and there are real challenges. However, people don't perhaps focus on HIV as much as they could or should. And the reality is, I would just add one thing, is that, often in our families, we don't talk about sex and sexuality and HIV enough.
That's for sure.
Right? I know in my family, we didn't necessarily do that. And in many families, it's a real challenge to have a real open and honest conversation about sex and sexuality and HIV with your children. It's hard. Mainstream families don't always do it very successfully either, by the way, but in some of our communities, it's really tough. And you add HIV stigma on top of that, and you add the other burdens that people live with on top of that, and it doesn't become as much as a priority for people to talk about, and thus they're more at risk for HIV.
Right. So those are real challenges that you face every day in your job here, Shannon. So what are some of the initiatives that you have, programs that you have here at Black Cap to address the needs of those people who are either living with or at risk for HIV?
So we do a lot here at Black Cap. I think a lot more than people ever believe we do. We really have kind of two pillars of the agency. One is prevention and outreach, and in our prevention and outreach programs, we're very focused on really doing one-on-one education, face-to-face education with people, getting condoms into people's hands, telling people about where to get an HIV test, as really important, tools that people can use to prevent HIV, to reduce their risk for HIV infection. So a lot of our work is done in community with a number of priority populations, including youth, including LGBT people, including also adults, by the way, who are actually more at risk for HIV in our community than anybody else, people 30 to 45. People often don't remember that. So we're out there telling this story of HIV as much as we can. We're at places like Caravana and Pride and all these community events where we just want to act as a reminder to people that HIV is relevant, you're at risk for HIV, and this is what you can do to significantly and dramatically reduce your risk for HIV. So we're telling that story in terms of our prevention and outreach work. We also have a support department, which has actually grown a lot over the past couple of years. 2007, we had 1 support staff. We actually now have 9 support staff. And they address a range of needs that people who are both infected, affected, at risk as well, have in relation to really kind of the personal, social, emotional, psychosocial supports that they require. A lot of our work with HIV positive clients it's not necessarily focused on things like getting access to treatment or finding a doctor. It's often the other issues that we're supporting people around, whether it's housing or employment or ensuring access to the healthcare system or the successfully mediating the immigration system. These are real challenges that our clients are dealing with, and we're there kind of face-to-face, one-on-one, giving these folks the support they need to really live successful and healthy lives. Right.
So I imagine that you probably have as many, if not more, volunteers than you do staff to do this work. 'Cause
indeed.
There's a lot of work to do.
Yeah, indeed. Volunteers are a very important part of our work. We are only a staff of 18, 19. We could be a staff of 100 and I think still experience a lot of demand for our services. That's the reality. And given that reality, we depend on the support and services of volunteers. We have about 140 volunteers who are actively engaged with our agency. They gave more than 7,000 hours of service to our organization last year. And they're kind of, integrated across the organization in almost every area of work that we do. Right. And they're very important to us.
Right. So you're based in downtown Toronto, but I know that recently you had an initiative to ensure that your work goes throughout the city here and in fact beyond through your partnership with the African and Caribbean HIV/AIDS Council in Ontario, right?
Yeah. So ACHO is an important partner of Black Caps. ACHO is the African Caribbean Council on HIV/AIDS in Ontario. It's a group of individuals, organizations, and leaders involved in really leading the response to HIV in Black communities across the province of Ontario. They play an incredibly valuable role in ensuring that HIV work in Black communities is not only focused in Toronto, and it's really easy for that to happen because there's a huge geographic concentration of Black people in Toronto right now. But the reality is there are also Black people across the province. And 10 years ago, there was not much in terms of support for those folks. And as a result, the AIDS Bureau in Ontario from the Ministry of Health and Long-Term Care worked really closely with community to say, we need this provincial strategy in place to address this kind of inequity that exists in terms of service delivery for Black communities. And thanks to the AIDS Bureau and thanks to the leaders in my community who said, we need this strategy, we've seen a lot of positive growth take place in terms of staff and agencies across the province who are serving Black people who are either at risk for or living with HIV and AIDS. We've seen a greater kind of level of collaboration and coordination province-wide and across regions in the province to better serve Black people in the province who are living with or at risk for HIV. And we've seen, some organizations kind of turn around in relation to, 10 years ago they were serving probably 90% white people. And now in some cases it's 30 or 40% of their clients are Black people. And that's because of this strategy. And it's been a very kind of an important response to the realities of HIV across the province of Ontario. And it's a great success that we've achieved collectively.
Congratulations. Now, I know there are a lot of challenges at the moment, particularly around issues such as immigration and for the financial backing that you get from government. What are some of those challenges specifically, and how are you managing them?
AIDS work is challenging work. It's really hard work, and there's always a challenge. But I've done this job for 6 years, and I've got to say that in terms of policy and legal responses to people living with HIV and AIDS, I don't think it's ever been worse. The last year, we've seen 2 significant decisions and 2 significant changes that have really affected significantly the lived realities of Black people who are living with HIV and AIDS. The first is changes in the immigration process. Our government, Canadian government, has made a number of changes to immigration policy and law that has really had a detrimental effect on newcomers who are either living with HIV/AIDS and also LGBT newcomers, many of whom, both of them, come to Canada as refugees. The refugee claim system has really become much more constricted. The timelines and deadlines have become much more black and white, much more kind of condensed, and we're seeing a lot of people being deported right now. which is really unfortunate, right? Many of our clients who are refugees come to Canada to live a better life, to escape persecution and violence and, in some cases, murder in their countries of origin. They come here for a safe haven, and our government, unfortunately, right now is sending many of those folks home. And from my perspective, they're being sent home to die due to lack of access to healthcare, due to a lack of access to safe and secure services, due to a lack of protection from the criminal justice system. So both PHA and LGBT newcomers are having to go home to conditions that are not very friendly to their existence, right? So this has been a huge issue for us. I get very emotional when I speak about it because it's been a huge issue for our clients. We're losing people,
yes,
and we're sending them home to realities that are not very pleasant, and that's an understatement. We've also seen a decision by the Supreme Court of Canada over the past year in relation to non-disclosure and the criminalization of HIV, and some people said it was actually a good decision. And the reality is, upon a more thorough and closer examination of the decision, it's not a very good decision, especially for obviously for PHAs, but especially for ethno-racial PHAs from my perspective. The new ruling says, of course, you've got to use a condom. You have to use a condom, but you also have to have a low viral load now, right? This is the new decision, and the reality is, for many of our clients, they don't always have access to treatment, right? Many of our clients are undocumented, and therefore don't have access to healthcare and HIV treatments, and issues of adherence, issue of access to healthcare and access to treatment, really affect a person's ability to maintain that low viral load that is now the norm and now the exception, right? Expectation, I should say. And this has been a bad decision. I think a number of us are up in arms about this decision. I wish the Supreme Court had made another decision to at least maintain the significant risk model, which on some levels worked and some levels didn't. But again, this is another instance where our government, our criminal justice system, is really, from my perspective, attacking PHAs and really marginalized people. These are two decisions that have not helped people, and from my perspective, these are decisions that have hurt and will continue to hurt people, the people that we want to work with and the people that we want to support. And there will be, I think, significant, and are presently, by the way, significant negative health outcomes and negative personal outcomes as a result of these. And it would be nice to see these two decisions reversed.
Yes, real challenges there, Shannon. So what are your hopes for the future?
Well, my hope is to close the doors of this agency, obviously. I would love to be able to be the person who locks the door on the last day of the agency's existence, but that's a little while away, yes. I think, and I don't know if I'll be here that long, but that would be my hope. But I think my hope is that we operate in an environment, and this includes a social environment, a political environment, an individual and personal environment, and family environments that really address the high levels of HIV stigma that exist in our community. That's specifically in the Black community, but also in the broader community. I think issues of stigma against people living with HIV/AIDS have really, I think, informed some of the decisions that I've just talked about. They've made it okay to really judge an HIV-positive person negatively. It's made it okay for families to say, you're no longer one of us now because you're HIV positive. It makes it okay for the Supreme Court to make the decision that it just made. And my goal would be to see at least people to start talking about stigma in a really productive and meaningful way. I think it's hard for us as a sector to create that conversation, again, because people are worried about other things and they're talking about other things, but I've never seen on kind of a broad social level a conversation about this issue. And the reality is, if we're not talking about stigma, we're going to see more new HIV infections. The more we're stigmatizing a certain group of people, the less likely it is that we're going to do what we need to do to reduce the number of new infections and to give people the tools and knowledge and information that they need to reduce the likelihood of new HIV transmissions.
Well, Shannon Ryan, Shannon Ryan, thank you so much for taking time out to share with us something about the important work you're doing here at Black Cap.
It's my pleasure. Thank you very much.
Thank you. And I'm John McCullagh from PositiveLight.com.